Dr. Babatunde Ikpaye is a public health specialist and former consultant health specialist with the World Bank, and he joins us now from Abuja. Thank you so much for joining us on the program. Let's begin by asking your take on the new advice from the World Health Organization on managing COVID-19.
Thank you for having me. Good afternoon, Nigerians. Like I've said on this platform on several occasions, COVID-19 is an emerging public health concern, and then public health knowledge will continue to grow. And of course, as evidence emerge, and it will guide, of course, decisions to be taken around the prevention to treatment continuum. So it is good that some of the researches that have been done in some places, including Nigeria, have actually shown that after about 10 days of confirmation of infection, many of the positive cases are just from the viral particles that are still there, but that are not able to grow or cause any further infection. And this body of evidence, from recent research done somewhere in Singapore and some other places, have actually guided WHO to say, okay, instead of relying on the PCR testing, which will waste resources to define those that will be discharged, once many of the viral particles peaked, particularly after 10 days, are not infective and will not constitute any public health danger. So why don't you allow most of the patient to go, anytime after then? And so the guideline says, for those in treatment, if you are able to, wait after 10 days and they don't have any evidence of fever or any other symptoms for 3 consecutive days after 10 days, and then you do the peripheral oxygen of more than 95%, then you can discharge without, having to rely on a negative result. And of course, for any asymptomatic patient, after 14 days, they usually become ineffective. So, and it's a good news, and it will also help us as in Nigeria or as a country to use resources more efficiently.
But Dr. Ikpaye, don't you think it will also spark some fears, some anxiety over knowing that your test has come out negative and you're saying that this is not perhaps one of the reasons why you should be discharged? Because on the discharge criteria, it says a negative laboratory test is no longer required to discharge a COVID-19 patient.
Now, like I said, this is based on evidence. The reason why we traditionally insist on a negative test is to be sure that anybody you discharge is not able to, become a public health, embarrassment or danger to the public. But you see, if repeatedly studies have shown that after 10 days, even when you pick a positive test, those positive are just indicative of the RNA, of the nucleic acid that are left over, or the viral particle that are there that are dead. And then several culture that has been taken after between 10 to 13 days have shown consistently no viral growth. So with this kind of evidence, you do not actually need to, because you know that for Nigeria, we need to do many more tests. And then if you need 2 more tests, you actually deny some other people who actually need to be tested in the first place resources that is required to test them. I'll give you an example. For some other conditions, for instance, malaria. Once you test for malaria and it is positive, once you treat, you don't go back to test again once the person gets better. So I think what we need to do is to reinforce this evidence and make sure that Nigerians have a good understanding of why that decision is taken. And of course, we need to discuss it over and over again to bring public confidence into this body of evidence.
But seeing as well that it's coming, from the World Health Body, would you say that we are perhaps over-reliant on the international community to finding solutions to, what has been termed the novelty of the coronavirus?
Well, the solution has to be looked for everywhere. You need to know that many of the investigations and the research that are going on are also going on in Nigeria. So the mere fact that we don't come to Nigeria to say we have collected samples in Lagos or in Kano is also to hide the identity of the location and the people that may have been involved in the research. And it is part of the ethics of public health research to actually have some degree of confidentiality when it comes to those who have contributed to the body of evidence. So yes, the coronavirus condition and research is not novel to Nigeria. It's actually a novel public health to everybody globally, including WHO. And then, but as we begin to understand the epidemiology better, so decision-making processes is improved upon, and of course, resources are better utilized. Because what we need to do is that when we look at resources that are available within the control space, you need to balance the need to reach many more people, and of course, and the need to actually be unnecessarily detailed. So efficiency and effectiveness has to be brought into deployment of resources, because resources would never be enough anyway.
All right, seeing as the world is celebrating Environmental Day today, it's estimated that globally about 1 billion cases of illness and millions of deaths occur every year from diseases caused by coronaviruses. And about 75% of all emerging infectious disease in humans are zoonotic. Transmitted, to people by animals. And we've been told that nature is sending us a message. What do you think we can learn from a day like today, World Environment Day?
What we need to learn is that we need to be cautious. We need to know that as the world continues to be reduced into a smaller global village in terms of interaction between man and man, and of course the interaction between man and animal, and of course between man and other species, we need to begin to take serious caution. And the lesson from COVID is that the world will emerge with what we now call the new normal. And in time past, the way we greet people and the elderly before now is that many people will have been scolded if you had greeted, if you greet any elders or any elder the way we do now. But a whole lot of things have changed, and of course the lessons from Corona should go beyond this epidemic period. And then we also need to begin to take seriously and significantly environmental hygiene, environmental management, and of course, issue around the personal hygiene. Because, of course, if you look at the history of public health, environmental health has contributed the most in terms of, achieving significant disease control globally, either from the period of smallpox to cholera to typhoid to now, to SARS and, of course, to COVID-19. It continues to, come to us that environment is very critical, and that whatever you throw into the environment will throw back at you.
All right. We'd like to appreciate your time, Dr. Babatunde Paye, public health specialist, former consultant health specialist with the World Bank. Thank you for joining us.